these techniques were more specific for the neck. So you can also implement all the other stuff you learned. You know, kneading. You can actually go and, you know, do some kneading in the area kind of thing if you want. You can do some, after you do this technique on the neck, you can, you know, do some rocking or do some other kind of kneading. Just play around with it. Okay. Again, we're just trying to increase the blood circulation, trying to get these shoulders to go down. So if you notice here, for what we're doing, we're just calming down the body. We're not trying to be super therapy fix stuff kind of thing. So all we're doing is just going to where his body kind of stops. So I just, and again, I'm using my body weight. I'm just kind of going where he wants to go and just kind of rocking. I'm not holding his head tight. His head's just laying there. So my point is you can implement all the other techniques all over the body. I'm just kind of being site specific, more specific to the area, and you can play around with it. But to make the video shorter, we're not going to show everything for each section. So now we're going to get into the chest area.
Okay.
And for starters, we want to do the neck, just stretch all this tissue this way. And then I want to make sure that his shoulders are fundamentally down where I kind of want them before I start working on that area. You don't want to have them all tensed up and then now you try to start working in. It's kind of, so whatever you can do just to kind of get them to, everybody kind of stretched out. So now we're going to work on the pecs. So again, what everybody tendency to have is we work in front of us. So our shoulders tend to get pulled forward. So what we're going to try to do is stretch the tissues in here and kind of work here with the concept of trying to get that to rest and go back. Okay, so again, we're not trying to fix it, that's just the general concept. So what I do is, before I work on the chest, just kind of relax, let me hold your arm up, is I'll lift up, put my hand underneath the scapula, I'll get them to relax, and then I just hook my fingers underneath the scapula, and then I'm going to gently pull. So in other words, now he's all stretched out and decompressed in that area. So now I can kind of start working on it. Relax. In a relaxed state, a person should be able to put their forearm like on a table. If this table extended, should be able to kind of touch it back. So I can give you an idea of how tight all this is. He's really not too bad. A lot of guys are usually up around here, just all tight. So you're really doing a pretty good job with what you're doing. Into these tissues, I'll start up, and then what I'm going to do is just lightly push down. I'm not trying to be pokey, doing this, putting my hand on this tissue's kind of going that way. And notice, I'm just kind of letting it fall. I'm not really trying to therapy. Therapy would be I'd warm up the tissue more, going deeper, and I'd really pay attention to the feel and really try to increase the flexibility. But again, we're just relaxing and de-stressing, so I'm literally like not putting hardly any weight on that. You can just kind of leave it there if you want. And as long as you're not doing too much, he'll stay relaxed. If I do happen to do a little bit too much, he'll tighten up and you'll feel it because his body's going, hey, what's going on? So, and we're mainly just focusing on the upper part of the chest, the main muscle, not into the breast tissue, just on the top and around the shoulder area. That's all we're trying to do. So it's just a kind of comfortable stretching that we're trying to do. Now, another way you can do this, put the arm down and relax. So around the collarbone, you want to feel that collarbone here. Everybody knows what the collarbone is. You're going just below it, and here's the sternum, that bone right in the center there. So you're just going right just past that, and I'm just lightly pushing. Feel a little bit of a stretch. Nothing crazy. I'm not trying to do deep tissue in. This is just because he has a shirt on. I'm just doing it like that. And again, we're just dealing with the upper part of the chest. That's really about good enough for what we're doing. Again, you try to implement some of the other techniques I
Right.
would have. You can play around with it, whatever. If it's super tight, again, we're just increasing the blood flow and getting it going and keeping it simple.